All right, I think we're going to get started. So good evening, everyone. My name is Kim Garrison. I'm the Director of Marketing at Heather Glen Senior Living and a board member for Lehigh Valley Aging in Place. Welcome to our Lehigh Valley Aging in Place virtual caregiver seminar. Our vision with Lehigh Valley Aging in Place is to be the leading resource to help seniors and their family members as they navigate aging and need solutions. Our comprehensive list of service providers are listed on our website and on our yearly resource guide. We also strive to educate and volunteer in the community we serve. Our goal is to have every senior age in place safely wherever they may call home. Since we were unable to host our in-person Senior and Caregiver Expo this year, we wanted to bring a number of education topics to you virtually. Over the next 4 weeks, every Tuesday at 7 p.m., you will find us here offering you informative speakers that will help you navigate the aging process. Tonight's speaker is Monica Werkheiser. Monica is a pharmacist with expertise in medical cannabis. She serves as the head pharmacist and general manager of Keystone Canna Remedies. Monica earned her Doctor of Pharmacy degree from Rutgers University. Monica was drawn towards a patient-focused organization that seeks to improve the lives of its patients and is responsible for empowering patients to effectively and responsibly utilize marijuana as a medication. She provides professional and compassionate consultations to tailor the therapy to each patient's need. Please welcome Monica Werkheiser.
Hi, good evening, everyone. Thank you so much, Kim, for the introduction.
Sure.
As Kim mentioned, my name is Monica. I am the pharmacist and general manager at Keystone Canna Remedies. And today I'm just going to be kind of going through medical marijuana, its presence in Pennsylvania, how we have been helping patients as our program has been in full fruition for 3.5 years now. I have been in the program and working for KCR for all of those 3.5 years. So I've seen quite a bit in my time here in Pennsylvania. So that's really what I'm going to be sharing with you guys today is, you know, what the program is, how it works, and how as caregivers you can really educate yourselves on this and just be there for those that you support and those that you love and care for, and really just arm yourselves with all the tools that you need. So I will bring up my screen. Oh, I cannot share my screen. Kim, are you able to help me out with that? Sorry for the delay. There we go. Okay. So I will bring this up and hopefully everybody can see my screen here. So as I said, I work for a dispensary, Keystone Canna Remedies. We are under a larger umbrella of the Terpenes Corporation. So we do have sister dispensaries called the Apothecariums. Let's try to advance here. Here we go. So as you know, medical marijuana has been legal across many states. There's actually 36 states currently in the United States that have medical marijuana programs. Pennsylvania is just one of those states. And there are states as well that have recreational programs. And what really kind of distinguishes the difference between those medical programs and those recreational programs actually comes down to use. And not a lot of people realize that. One of the biggest questions I get is, what is different? What different products do you have that they don't have in a recreational market? And the truth is that we have the same type of products. They all come from the same plants. So at the end of the day, we're all utilizing the same plant to produce our products. It's how those products are used as well as how those products are manufactured that really differentiates a recreational from a medical program. And as I mentioned, there are many more states that have medical programs than have recreational. So Pennsylvania is a medical only state. And we really distinguish ourselves from other states simply because of how we set our program up. So back in 2016, the medical marijuana program was approved by Governor Wolf, but did not come into actual practice until 2018. And so we were actually, as Keystone Canna Remedies, we were the first dispensary to open within this within the state of Pennsylvania. And we've had a lot of states to follow, but Pennsylvania really tried to take a very medicinally minded approach. So much so that the way we are run by the Department of Health. So every dispensary, every grow facility, every doctor who recommends has to go through a stringent process through the Department of Health in order to be certified and allowed to participate, to work in, to even be a part of the program. The other key thing about Pennsylvania's program is that they do require a medical professional to be within the dispensary. There's actually only 3 other states, and I believe actually as of this spring, we got a 4th state on board with recognizing the need for medical professionals to be within the dispensaries. A lot of states don't require that, and where they find issues with that is patients come in and they don't know what they need, they don't know what they want, they don't know how to utilize their product. So having medical professionals within the dispensaries allows for more one-on-one consultation with people who understand the disease state, people who understand medications, people who can look for interactions, and it can really take the time to explain proper usage. How do I dose? How do I take my medication? When should I take it? And what are going to be some of the better products for me? So that's been a really great tool that Pennsylvania has brought on, is having these medical professionals within the dispensaries available at all times. As long as the dispensary is open, a medical professional needs to be available to answer any questions for the patients. Another great thing of Pennsylvania's program was the approved forms of medication. If you looked at that first slide, some states restrict what you can have and what you can't have, and there are certain restrictions within Pennsylvania, but for the most part, Pennsylvania really tried to keep a broad range of product type. And what I mean by that, and you can see here in these pictures, there's a wide variety of different products available in Pennsylvania. Kind of going I'm going to say left to right. I'm thinking that's how you see it on your screen. But that almost peanut brittle looking piece there is actually called a concentrate. And it falls under the same category as all vaporizable or inhalable medications. The product next to it is a cartridge. And then far to the right is an actual piece of bud. And those are all inhalable forms. Inhalable forms become your fastest acting forms, as opposed to things like that syringe there. The syringe isn't for injection. I get that question a lot. The syringe is actually a very concentrated tincture that is a little too sticky or viscous to try to get in out of a dropper bottle. So you have to push it out of a plunger syringe instead. And the tincture there, and then again to the far right, those capsules, those are what we consider our edible or oral forms. As I mentioned, Pennsylvania doesn't restrict much, but one of its restrictions is going to be the fact that your edible or oral forms must be in a medicinal format. So capsules or a tincture, some kind of liquid that you swallow. You won't find in Pennsylvania gummies or cookies or things that are a little bit more palatable and a little bit more consumer friendly. I mean, we all like a good gummy bear. We all like a good cookie after dinner. They don't have anything pre-made like that. However, Pennsylvania's program does allow you to make your own homemade edibles. And that's where another use of one of those syringes comes about. Their third category of products in Pennsylvania become their topicals. And that's what that Soothe picture is there. That Soothe jar is actually a jar of ointment. Which is really great for those patients who are nervous about ingesting or taking anything by mouth. And we do get a lot of patients who are concerned about what will the effects be, how will they make me feel. So generally they like to utilize products like those topicals to start out with, where they can address pain issues right at the spot without having to worry about any mind effects, because those topicals are meant to alleviate pain directly where they're applied to, without the concern, again, of will my mind effects be altered. So here kind of again reiterates what I was going over with the different types of products. Really, we look at them as, do you need something short acting or do you need something long acting? As I mentioned, those vaped or inhaled products, something that's going to get directly into the bloodstream from the lungs, that's going to feel the effects within seconds to minutes. And for our patients who suffer from things like migraines or bouts of nausea and vomiting, or those patients who just have panic attacks even, having that relief come within seconds to minutes is key. And that's where these short acting or these inhaled products become a really, really key component. Those topicals, and they're not listed here, topicals kind of take a mid-range. Generally, it takes about 10 to 15 minutes to really absorb through the skin and feel the effects. And then your longer acting products come into your pills, your tinctures, anything really that you're taking by mouth. Because when you're consuming something by mouth, we need to remember that that goes from my mouth to my gut, then through the liver and into the bloodstream. So because it's taking longer to digest and process through the body, it can take up to an hour, really up to 2 hours to feel the effects. However, because again, that's that long effect, you will feel that for longer. So that effect will be there for 8 hours. So if we're looking at somebody who suffers chronic pain, the pain does not go away. It is always there. It's better to have something longer acting. Or for instance, I look at sleep with people. Do I need something to get me to sleep? That's where I want shorter acting, something that's going to help me go to bed, as opposed to I can fall asleep fine, but I am up every hour on the hour. We want something a little bit more longer acting for those patients to help them and draw that experience. As patients get more comfortable, they can layer. Maybe I use a short acting to get my relief right away, and then use a longer acting product to extend that feel or that effect. Here's a list of some of the conditions that are approved in Pennsylvania. There are currently 23 conditions. So this is another big key thing of Pennsylvania's program. We have medical professionals on staff. We have medically approved dosage forms. And now we have medically approved conditions. Each and every one of these conditions is assessed and reviewed by a panel of medical advisory board. So the Department of Health has a specific medical marijuana advisory board who looks over these different conditions, sees what studies are out there, and says, yes, marijuana can be effective for these conditions. And I know a lot of patients tend to question when I say studies that are out there, because there are not a lot of studies in the United States. But I do always like to point out that medical marijuana isn't just limited to the US. Medical marijuana is actually available all throughout the world. And there are a lot of countries who are making advances in studies, so much so that there's a few pharmaceutical companies out there in other states, or in other countries, excuse me, who are developing products based off cannabis. What's interesting is even in the US, we have one pharmaceutical product that was approved, and it was derived from a cannabis medication. It's called Epidiolex, and it's derived from a cannabis plant. It's solely CBD in there. There's no THC to it, but they use that to treat seizures. And so it's the first product of its kind that was actually approved by the FDA and is coming from a marijuana plant. That same company that developed that has patents in other countries for MS drugs. There is a pharmaceutical company, Zalera, who is actually working to do the first clinical trial on autistic children, and I believe that's happening in New Zealand. So studies are happening all around, and this is where we get the information to say, yes, this is a valid condition, and that's why we know. And this is really where we drive into, how do we know marijuana works? How are you going to know that it's successful? Because we do have limited information here in the US because of the limited studies, but that doesn't mean that there's not information out there. The picture actually that you see in this is a compilation of all the studies that have been put out about cannabis and its use in different disease states. So it's a great reference source. I don't recommend that you take the time to read it on your own. It's very thick. It's very, very thick. But once in a while, you can always flip through it if you feel like it. But I'm going to kind of break down a little bit some of the studies that come from that book, what we know, and what we've seen, and what we're looking to find out from cannabis, and how we use all that information to make sure we're getting the best care. So as we look through on these studies, we look through on how cannabis works, we know that it's there to help with pain, nausea, and vomiting. There's pharmaceuticals that are created based around how marijuana works to help with nausea and vomiting. For anybody who's heard of the medication Marinol, it is a synthetic or a man-made marijuana product or THC product. So they tried to isolate that chemical in marijuana and duplicate it so that they could get relief. Marinol has actually what they call a off-label use for pain relief as well. Again, we talk about MS spasticity symptoms. And I mentioned that company in the UK who puts out a one-to-one product, Sativex, that's specifically used for MS patients. Again, we have uses for sleep, appetite, weight loss, improving anxiety. And we're going to go over all of this as we go through the presentation. So again, just getting some basic understanding of cannabis and how it works in the body really helps a lot of our patients understand how they should be using it, why they should be using it. We spend the time going over with them what the endocannabinoid system is. And a lot of you, I'm sure, have not heard of it. I myself had not heard of it really until I started deeper diving into it. The endocannabinoid system is actually the system in our body that maintains homeostasis. So it regulates our temperature, it regulates our mood. It's really just regulating anything that creates a balance within the body. And so we don't generally have medications that target balance in the body. Hence, not a lot of this is taught in pharmacy school when you're talking about a system that we don't use medications to target. It's not like we, when I learned about the cardiovascular system or our heart system, because I had to learn about heart drugs. I had to learn about, our neurological system because I needed to know about nerve drugs. So here it's the same kind of concept. We're learning about the endocannabinoid system to learn about how marijuana is going to help reset balance within the body. And as you can see here, we're listing our two main receptors, CB1 and CB2. But what I find really fascinating is that marijuana also works on other receptors in the body, the same ones that some of our other medications work on. They work on the same receptors that gabapentin does. Gabapentin is used for nerve pains. They work on some of the same receptors that your anxiety medications work on, some of the same receptors that your heart medications work on. And this again becomes why marijuana is so versatile across so many conditions. Again, we have 23 approved within the state of Pennsylvania. However, there are many more that can be approved. Currently, the state is working on approving hepatitis as well as traumatic brain injury to add to the list of conditions because there's a lot of promise for how marijuana can help in those situations. I also like this diagram here because you can see the dots of where all of those receptors are within the body. And it just is extremely fascinating that you see these receptors are found from head to toe, arm to arm, everything in between, in our organs, in our brain cells. Again, just reiterating why we are so successful with marijuana as a medication. So understanding this a little bit deeper, there's different parts to the marijuana plant. One of those parts is cannabinoids. Cannabinoids, most people are familiar with the big ones, THC and CBD. That's really what a lot of people know, but there's actually over 113 different cannabinoids that are causing different effects, different medicinal benefits throughout the body. While we look at things like THC, a lot of times people get concerned that this is the psychoactive one. I don't want any THC. And I spend a lot of my day helping people understand why THC becomes a necessity for them. Part of that reason is, yes, THC does cross the blood-brain barrier. So it does get into the mind to elicit some effects. But what we don't realize is that if we moderate our dose, if we take lower doses, we no longer have to worry as much about the psychoactive effect and instead start thinking about the fact that if THC is crossing into the blood-brain barrier, it can actually touch on our nausea response. It hits on that vomiting response in our brain. It also hits on our mood centers and helps to calm or to help more so with that fight or flight response. We also look at THC when it's crossing in that blood-brain barrier as regulating in some of our pain signaling pathways. And this is a lot what we'll get into as we go on, but it's good to recognize that just because something is reacting in the brain, we can control that by controlling our dose. We can also control it by utilizing other parts of the plant, and that's where CBD becomes part of this. CBD does not produce a mind-altering effect because it does not cross the blood-brain barrier. However, it does help to regulate how THC works in the body. It helps to bring down some of that psychoactive effect, but as well works throughout the body and kind of amplifies. So THC can be an anti-inflammatory, as can CBD. And as we all know, 2 is generally better than 1. So if I'm able to address that same symptom from two different pathways, one through the brainstem and one through the body, I'm now creating an even bigger response and an even bigger pain relief without having to have multiple medications. And for any of you who know, multiple medications is a lot of the way with traditional pharmacy. I'm working in the traditional pharmacy. I see people who need, well, I've got this pill for my nerve pain, this pill for my inflammation, and this one for my muscle pain. And knowing that, again, and I'm going to flip back my slide here, there's 113 different cannabinoids in one single plant. That means I'm addressing those problems with one single product as opposed to three. The other thing that we look at in the plant are called terpenes. And a lot of people are more familiar with terpenes by essential oils. A lot of essential oils are using terpenes, the smells of the plants, what produces that smell, that taste. Those actually do provide medical benefits. So terpenes are found within all sorts of plants. They are FDA approved to be in all different types of products. You'll find terpenes in your soaps, in your perfumes. Again, think of that aromatic. But these terpenes that are found in cannabis plants are utilized to help produce effects. We listed three here, and that's three of over 200. But these three are tend to be one of the bigger terpenes, if you will, that are found in the plant. Limonene being one of them, which is going to be more mood forward. So limonene is really known to help with an uplift of mood. So thinking depression, helping to provide that lift out of depression. It also produces a gentle kind of pleasantry to help manage anxieties as well. When we look at myrcene, myrcene is actually found in mangoes, and it actually produces a more kind of body relaxation as well as mental relaxation. So a lot of our patients who suffer from pain and sleep issues, this becomes a really nice all-around terpene to produce, again, that body relaxation and that mind relaxation. And then our last one on this slide is linalool. And linalool is one we look at for our real anxiety-driven patients, because linalool comes from lavender. And we see lavender in a lot of those calming, sleep-forward products. So we really like strains that have high linalool when it comes to anxiety patients to produce this kind of calm, relaxed state that's not necessarily sedating, but again, just producing this overwhelming calm to allow for that relief from those panic attacks. So understanding all of that is really how we work with our patients to produce and to find the most effective product for them. And there's a lot to factor in there. As I said, 113 cannabinoids, 200 terpenes. We don't expect our patient base to know that. And that's, again, why it's so important to have a medical professional inside these dispensaries to really help guide people through their therapy, through their treatment. And what's nice is those medical professionals are there when you need them. They don't always have to be. If you know what works, you know what works. You don't have to sit with them. But if you want to because you need some help, that's what they're there for. And again, looking at what do we utilize that has the most benefit? So you can utilize one, maybe two products rather than 4 or 5, or taking pills for your pills. So looking more specifically at the aging population, there are more and more older adults over 65 that are using cannabis or marijuana to really help with all different types of symptoms and disease states. AARP does a lot of different articles and presentations just going through how medical marijuana benefits to help with all these symptoms of diseases and can help prevent some of the side effects from treatments. I really do like how AARP lays out that we're working with the symptoms of the disease. One thing that I never really like to hear people say is marijuana can cure this or that. It's not really the mindset we work in. At the end of the day, the disease is the disease, but how do we help to moderate it, to minimize those symptoms, or to help remedy some of those side effects from treatments? So looking into some of those more specific disease states that we see among our patients over 65, we can take a look at anxiety first. So anxiety is the number one reason that patients get certified for marijuana in the state. And really what we're looking at is what what is the driving force behind the anxieties? Is this a general anxiety that's all the time? Is there a disease state behind it? Is this more panic attacks? And we work with patients to really find those right products. So a lot of times we will recommend products that are higher in CBD. Again, CBD will start to target some of those same receptors that a Xanax will. It'll start to hit on those without being as binding. And that becomes a big question for patients is, what about the addiction potential? And I am going to hit on that a little bit more, but understanding that CBD does not bind, so does not hit or like grab onto those receptors as tightly, meaning our body doesn't continually crave it, doesn't continually want it. What's nice is because it does hit on those same receptors, a lot of our patients who are on high doses of their anti-anxiety medications, whether it be Ativan or clonazepam, they are able to start reducing off those medications because this is able to help them get to lower levels and safely get off those medications to something that is less addiction potential. A lot of those anti-anxiety medications aren't covered under Medicare or Medicaid, Medicare more specifically, excuse me, because of the fact that they're not considered safe in an older population. So this has been a nice tool for a lot of those patients to still get that anxiety relief and be able to maintain lower levels or get off those medications. We will sometimes recommend THC for anxiety. THC becomes good when it's more of a fight or flight response. Again, I mentioned THC hits into the brain, and in there, it will hit on the amygdala or our fear center. And by hitting on that fear center, it helps to calm those fears that we have. So it becomes a nice tool for those patients who are having a more fight or flight kind of response or more fear induced response, maybe more induced by a PTSD reaction. Again, we look at, like I said, all those components, linalool for the calming. We also look at how it can affect on sleep. A lot of our patients who come in for sleep issues come because they are anxious in the evening. They feel more jittery. And again, with that fear, that anxiousness at night, we will generally tend to lean towards a more THC driven type of product, as opposed to our patients who suffer sleep issues because of maybe a lifelong insomnia where there was never really an underlying cause. It was always just a more genetic type, if you will, of insomnia. We will lean in towards a little bit more CBD to reset the sleep-wake cycle. One of the other leading causes that we see older populations come through is for cancer. One of the nice things about Pennsylvania is they didn't just include cancer as the condition. Cancer and remission therapy is really what the condition is, which means those patients who are not undergoing active treatment, but who are still experiencing maybe side effects from treatments or side effects from their cancer are still eligible to utilize marijuana to manage those symptoms. So it is a very progressive thought process for the state to not only recognize that those in active treatment could benefit from marijuana, but also those who are undergoing remission or, not currently in treatment. So marijuana is recognized by the National Cancer Institute, the American Cancer Society, by numerous cancer associations as a valuable tool for those who are dealing with cancer or cancer-related symptoms. Again, I mentioned THC getting into the brain and helping to hit on that nausea center. As well, one of the interesting studies that they had out there looked at specifically platinum types of chemotherapy, which are often used for breast cancer. And what they noticed is if they actually initiated marijuana when they were initiating chemotherapy, they were able to reduce the prevalence of the nerve pain that comes from it by 30%. Which I know seems like a small amount for anybody who has gone through that chemotherapy and has had that residual tingling in the fingers, the toes, that wakes them up at night. You know what kind of reduction that really is. So it was very interesting to find that not necessarily using marijuana as that, well, now that I have my symptoms, I have to react to them, but being a little bit more of a preventative type of medicine. So knowing that if I'm going to have my treatment and day 2 and 3 are the worst, maybe I can lead up to that with the treatment, or I can prevent or stave off some of this nerve damage by utilizing cannabis as I start my treatments. The other thing that they really recognize marijuana for is going to be improving food intake. So a lot of times we see that weight loss that comes with chemotherapy and radiation. And what's nice is marijuana, again, keep going back to the THC hitting inside the brain, but it is able to stimulate a different type of appetite. And what I mean by that is it's not actually creating a hunger. What it's actually doing is reminding us of a more pleasurable eating experience. So one of the other areas that that marijuana hits on is the hypothalamus, which allows for really targets in on that happy response. And so that reward center, it is the reward center of the brain. And so it brings us back to making eating more rewarding. And that's probably one of the biggest misconceptions with patients, is that it's the not, or with people just in general around cancer therapy, is that appetite loss comes from the nausea and vomiting, but it actually comes from a lack of joy of eating. There's just not a want. There's no craving to eat. There's no craving to consume. So to be able to hit that reward center and make it more pleasurable, more enjoyable again, we're starting to just reintroduce people back to eating. The other thing can be stomach damage. And that's where, again, that CBD working in a little bit more of the periphery of the body helps to, again, regulate some of that digestive process. A lot of our Crohn's patients and those with stomach disorders can attest to the fact that they will utilize CBD to regulate that digestive system to make it easier for them to consume or eat. I'm sorry, I do want to touch on one more thing, because I do get this question as far as the confusion around when I talked about, I don't like to look at marijuana as a cure as much as a symptom treater. And this is especially true in cancer. We look at a populations whose treatments, and we're talking cancer treatments, are not 100%. And that is the same with marijuana. There is research out there that looks at marijuana and its properties to kill cancer cells, to cause cell death, to stop the growth of cancer cells. The issue being is that marijuana is very similar to most traditional, is that there are too many different types of cancer, subsets of cancer, that you really need to pinpoint what strain works with what subset. And again, with research being out there but still limited, the idea of pinpointing a marijuana strain that's going to help on a specific cancer is very small. So generally, I encourage most of our patients who have cancer or undergoing treatment to stick with helping to manage symptoms, helping to allow them to continue treatments, and to use it more as an add-on as opposed to a sole agent. However, should a patient want to go down the path of looking at how does marijuana treat and potentially help to reduce my cancer or my tumor load, we do have the medical professionals on staff to walk the patient through that, to really go into what it would take, how much you would have to consume. And honestly, we have the conversation of what that would look like on your pocket. We are very in tune to the fact that this is out of pocket for patients. So we make sure to work one-on-one and try to make sure that this is not only something that they can tolerate on their body, but that they can also tolerate on their wallet. Because at the end of the day, we're here to help people, not hurt. And that does include the money we've earned. So one of the other areas that we see, and this is going to be one of the more uncommon areas, but we do still have patients who come in for glaucoma treatment. Cannabis has been introduced as an agent for glaucoma treatment, but really it becomes a more longer acting than necessarily shorter. So I talked about the different dosage forms, the quick acting, your inhaled products versus your longer. Glaucoma is one of those that we'd want to look at as something more longer acting treatment, because THC is actually what can help to reduce intraocular pressure. And the problem is, or I shouldn't say the problem is it's only effective when it's inside the body. So if we're using something shorter acting, you're going to be continually using it just in order to get the effect. Whereas if we use something longer acting, that will stay with us longer to keep that reduced eye pressure. What's nice is a lot of times with our glaucoma patients, we aren't talking very large doses. They're usually very low dosed. So they're not producing that mind effect, but they are producing that reduction in eye pressure. Here we look at the area of neurodegenerative diseases. So you'll see at the top of the slide, I mentioned Alzheimer's. And one of the things is Alzheimer's itself is not listed out on our condition list. All that is listed is neurodegenerative diseases. And that's because neurodegenerative diseases encompasses a whole slew of different types of diseases, different palsies, different spasticity types of diseases. But what's interesting is Alzheimer's does fall under that category. And we do have a few doctors who do recommend marijuana for Alzheimer's disease. And I know that this can be an area of confusion for a lot of people because their first thought of marijuana is, again, it's messing with the mind. Isn't there short-term memory loss? I know what I saw in Reefer Madness. Actually, all of that is just propaganda. How this actually works in Alzheimer's, it can work symptomatically, as I mentioned, helping with the anxieties, the agitations, the mood control, even the appetite sector with Alzheimer's. But some interesting nuances or features of the marijuana plant are the different terpenes that are also in there. So one thing that they've been studying in mice is different terpenes like pinene. I know I haven't mentioned that one before, and linalool, and how they not only help to produce a more acuity. Pinene's actually known to produce more of a focus feature. And then the linalool actually working to produce the calm, but they're also working on different plaques that build up in the brain. And so what's interesting is they noticed that when they used linalool and pinene, and really linalool produced the biggest effect, they noticed that it actually started to slow the buildup of plaques. It didn't, again, and the lesions, it didn't reverse the disease. And again, I keep trying to reiterate, it's not here about curing, but how to create a better quality of life. And so if we can slow that progression by helping to detangle some of those lesions and decrease some of those plaques in the brain, it just, again, allows for a longer, sustained, better quality of life. Parkinson's becomes another one. And actually, Parkinson's was listed first, and then neurodegenerative disease. Parkinson's would technically fall under the category of neurodegenerative diseases. But it is listed as its own entity on the list of medical conditions. So Parkinson's disease, we look at a few things. We look at everything from the tremors, the rigidity, the spontaneous movement, depression, anxiety, sleep disturbances. What's interesting is that marijuana can play a role in all of these different areas. There's a lot of studies out there that show a huge impact of CBD in these patients. One study that I find very interesting actually talks about the sweating feature and how CBD can help to regulate. We talk about that cannabis can help to regulate body temperature, but CBD in general being a little bit more on that sweating feature. Some of the other things that we look at, looking at how THC and CBD together can help improve those motor skills. And one interesting factor is that one of the medications, and one of the most popular medications, levodopa carbidopa, and specifically that levodopa, can have side effects called dyskinesias, which cause involuntary movements. And they notice that when patients use marijuana with that medication, it reduced that side effect. It's not just about reducing the side effect, but about keeping compliance. If patients are having side effects, their medications, they are less likely to take them. So if we can reduce those side effects, they're more likely to stay with that medication to get the results that they need. So there is something nice there about pairing those two together, but also knowing that marijuana in and of itself can help with a lot of these different features. Again, we look at marijuana being an antioxidant and anti-inflammatory in the brain, which again just starts to help with some of these add-on features. Here we're going to look at pain. And pain is a feature, it is the second most prevalent condition that is prescribed for medical marijuana. And it's especially important when we talk to patients to understand what is causing their pain. Really looking at, is this going to be nerve pain? Is this going to be muscle pain? Is this going to be damage, inflammation? Was there an injury? So I really try to break down with patients, are we looking at what I have here, nociceptive pain, or nerve pain on the next slide? So nociceptive is more of that injury type pain, that musculoskeletal pain. And we'll generally use THC a lot for those types of pains and add on CBD when necessary to increase that anti-inflammatory effect. What's interesting with these types of pains is that we can address it, THC relaxing the muscles, bringing down the inflammation effect, but also working on the pain signaling through the brain. And one of the first things that we notice with our patient base is they will say, my pain's still there, but I don't think about it as much. And I think that's something that people really underestimate for those patients who are in pain all the time. When you are in pain all the time, you're constantly in excitatory state. You feel everything tense and you're always there. And it's like your body's almost anticipating the next pain spasm, the next pain spell. When won't I be able to do anything? Well, now I'm anxious, and anxiety, as we know, exacerbates a lot, including our pain. And so we're constantly in this struggle of being so elevated that the first thing they notice is that calm. And now that I'm able to kind of rebalance or reassess the pain that I'm feeling, I start to realize that where I was always feeling I was in a 10, maybe I'm now in a 7 or a 6. And then as time progresses, we start to notice the changes in the body. That's where we start to notice a little bit of decrease in inflammation. A lot of times I'll hear it from a patient's practitioner, if they're going to a massage therapist, like, wow, I don't have to target that area quite as much. Some things are seeming different. But that seems to be the progression. Most people notice first that their pain signaling becomes a little bit more steady state rather than that excitatory state they're always in. The other fascinating feature about medical marijuana is that it can actually be used in conjunction with opioids. And this seems very counterintuitive. And it was very counterintuitive for a lot of our medical professionals that we work with, doctors' offices. A lot of them felt we've got to get our patients off their opioids first, and then they can start medical marijuana. However, that's not the case. The reality of the situation is that marijuana works in a different system of the body. So it's not working in the same areas. So therefore, it's not elevating and can't lead to an overdosing potential with the opioids. Instead, what happens is because it's starting to work in different areas, it's allowing, again, that double-edged benefit, which is then allowing patients to step down on their opioids and not have to get to those concerning levels. Because one of the biggest concerns with population over 65 becomes the potential to have respiratory distress or any of the other overdosing side effects, but most importantly, respiratory distress, not being able to breathe. So if we can keep out of those levels that start to lead to that, we keep a much safer for everybody involved. So as I mentioned, we look at pain differently when we look at nerve pain. And one of those reasons being, we do tend to utilize a little bit more CBD when it comes to these patients. Again, we will try to look at both sides, the THC and CBD. Again, THC for the pain signaling, THC also helping at inflammation at the nerve endings. But CBD generally helps to relieve some of those misfirings and also helps to regenerate some of those nerves where those nerve damage has happened. So that's where, again, we treat that a little bit differently than we do where maybe musculoskeletal, we go slightly heavier on the THC, where nerve pain, we go slightly heavier on the CBD. And that can be any kind of nerve pain. A lot of times I get questions about, well, what about my diabetic neuropathies? Yes, those do qualify. What about I have shingles and I have residual pain that's been with me for a year now? Yes, that would qualify as well. Again, we get into these effects that start to work synergistically or work with their other medications. One of the things I've noticed is Lyrica becomes a largely prescribed drug, and gabapentin for nerve pain. Problem is both of those drugs were originally established as seizure drugs, so cause a lot of problems in the mind, and especially in those patients over the age of 65, and become not recommended drugs again because of that. So if we can utilize some CBD to, again, hit on some of those same receptors, but not produce that mind effect because it's not crossing into the blood-brain barrier, we do produce then a nice balanced effect and maybe not have to get to such high levels that we start leading to the sleep issues, the brain fog, and all those other things that come on with pharmaceuticals. So, talked about all the benefits of marijuana. I never like to leave people without talking about a more balanced perspective, which is there are side effects with marijuana. What is different about marijuana side effects from traditional pharmaceuticals is these can be reversed just by lowering dose or stopping medication. And as some of you might know, traditional pharmaceuticals, you can still have your side effects for years, even after stopping use. So the good thing is these are reversible side effects, and a lot of them are just preventable. And what I mean by that is it's all about dose. If you do too much, you're going to get a little bit too much of an effect, which is what can lead to these. So if you stay in a more managed dose and follow our protocols of low and slow, you can generally avoid these side effects. Things like short-term memory loss. I mentioned that there's certain strains of marijuana that have pinene in them. Pinene in and of itself is meant to combat that short-term memory loss. There are certain products that have built-in safety nets. Dry mouth and dry eyes, again, just moderating use. Increased heart rate. Increased heart rate generally comes from, again, consuming too much THC. So we often educate our cardiac patients about really honing in on that low and slow approach. Take a little bit, take a pause, see how you feel. Maybe not take any more till the next day, and increase slowly so that you know the effect before you get to the point of an increased heart rate. Same thing with paranoia and anxiety that becomes a facet of too much or too much ingestion. And some people who are THC sensitive and get it even at low doses will instead initiate some CBD to really counterbalance that. Dizziness can come about in two ways. And what's interesting with dizziness and our older population actually comes down to blood pressure. You can get dizziness from overconsumption, but one of the benefits, if you will, of marijuana is that it does lower blood pressure. So we do take a look at the medication list of our patients. If they're on more than 2 blood pressure medications, or really 2 or more blood pressure medications, we will instruct our patients that if they are feeling dizzy, to first take their blood pressure. There is a decent subset of our older populations who's had to decrease or stop one of their blood pressure medications because the marijuana is doing enough of a job to decrease that blood pressure for them. Cognitive impairment, again, that ties into too much consumption, vomiting, and hallucinations, all about too much consumption. What's interesting is the vomiting can be treated at home. One of the things is just to jump into a hot shower, maybe not jump, maybe walk, it's slippery, but to just go into a hot shower. Or the other thing is for anybody who has arthritis, I'm sure you have capsaicin gel at home, capsaicin right on the sternum. That heat production there will help to, again, stop the vomiting. Now, I know I went over the side effects, but again, I like to keep a balanced perspective. Here you can see the dependency potential and the lethal dose potential of all these medications. And one thing that you'll notice is that to the right, towards the top, is morphine, a pain medication that many people are on. And that has a very high addiction potential, as well as a lethal dose that's much smaller than marijuana. Marijuana has no attributable deaths to it. Morphine, on the other hand, does. And that's where we kind of look at marijuana becoming the safer alternative for a lot of patients. It has not killed anybody. It may have made somebody feel uncomfortable because they did too much. But again, that's why we instruct on how to take, how much to take, and how to escalate slowly to get to that safe, comfortable point. The dependence potential is low with marijuana as well, because of the fact that the dependency with marijuana becomes more mental, or more of that psychosomatic kind of dependency, as opposed to a chemical dependency. And what I mean by that is that when we look at something like morphine, oxycodone, our body physically craves it. The receptors know it's not there, and you start to have a reaction, whether it be seizures, stop breathing, or vomiting, all these the shakes, these really visceral kind of responses when your body knows it's not there. As opposed to marijuana, which becomes more about, I know I was using, it was helpful, and I don't know what I'm going to do if I don't have it. If you were to stop marijuana right away, you don't go through withdrawal. You don't get the shakes. You don't get these vomiting spells. You don't get the seizures. You could be a little grumpy for a couple days, but other than that, that's really what you're looking at. One thing to kind of consider here is, again, just looking at the death rates for different types of products. And on there, you see pharmaceuticals as well as street drugs. When it comes to opioids, that's a higher death rate than most street drugs. And that's concerning. When they introduce medical marijuana programs into many states, they realize that they have this big reduction in these needs for these other medications, and thus the death rates decrease. One thing that is very progressive about Pennsylvania, because they're one of only two, actually might be three at this point, states that do have an approved condition for opioid use disorder, because they have seen such benefit in being able to address the issues, whether they are using opioids or street drugs for pain or to treat mental illness, or they just got into it recreationally and just need a way to stay off them. So it is really very progressive of Pennsylvania to be one of the few states who really recognizes that as an alternative. So I'll end the presentation just kind of going through, if you're interested in signing up for the medical marijuana program, there's really just 4 easy steps here. Going to the state website and registering your profile. You register that by using the information on your driver's license, which seems relatively easy and really should be, but I do want to hit on a key point here that when you are registering online and you have to input the information from your state ID, it needs to be identical to the state ID. So if you are writing, if on your state ID, it says street, S-T-R-E-E-T, you need to write out street, S-T-R-E-E-T. It will not accept an S-T or an S-T period. If it's all capitalized, you need to be all capitalized. I always like to give the case in point of my own family member who was signing up for the program, and we had it perfect. I was helping her. I do this for a living, and we still couldn't get it to go through. When that happens, you call PennDOT to find out what the issue is. They let us know that there was 2 spaces between the number of her street address and the words, which there is no way to see that on a state ID, that there's 2 spaces in there. But they were able to correct that for her, and we were able to get that fixed. So when I say identical, I mean identical to your state ID. Once that's done, you're then going to want to go onto the website and find a doctor that can certify you. And one thing that's nice is you don't have to go to a doctor that is specified for your condition. I think that's one of the biggest misconceptions in signing up is that, oh, if I have pain, I have to go to a pain doctor. If I have anxiety, I have to go to a mental health practitioner. That's not the case. These doctors are certified for marijuana. So if you're a male, you can go to the OBGYN. If you are there for anxiety, you can go to the cardiologist that's there. They're there to certify based on marijuana. They're not there based on their specialty. So you can actually go to any of those doctors, and those doctors are listed by county in order to find them. Once you've got that certification, and really what they're looking at is, yes, you have the condition, and yes, marijuana is going to be helpful for it. You would then go back onto the website to pay for your card. The card cost is $50 is $50, but I should say for those who have government assistance, they reduce it to $25. You just have to put in that information. So if you have PACE or PACENet, that would reduce it to $25. Once that happens, then you would come visit us at the dispensary, and we'd go over what's happening, why it's happening, and how do we really utilize marijuana to help with that situation. I also have here the instructions for caregivers. So you can actually have a caregiver to help you with your medication. And those caregivers, that caregiver signs up pretty similarly as the way that the patients do. Really, the only difference in steps comes down to the caregiver goes on, they register in the state system. They do not see a doctor though. Instead, they just go for a background check with the state. And then they pay for their card, and then they're able to assign to that patient. And what that means is they can go in and they can pick up medications for that patient, sit in on those consults, ask the questions, really be there as that caregiver or caretaker, which really comes up to be important when we have patients who are having surgery or treatments that they can't get out of home, or even something as much as it's snowing outside and I can't get there. So having that caregiver is really great. And it is really nice seeing families that are caregivers for their loved ones, so that they can be part of that journey. Because the journey in cannabis can be very frightening, especially to those who don't have experience with marijuana. And so it is nice to have that person be with you. We always encourage people to have resources at home, somebody they can talk to or go over things with. But having that person actually be there at the dispensary definitely has been a big help for a lot of our patient base. So Here we can see that Pennsylvania did divide up the regions. So there are dispensaries all across Pennsylvania. Again, one of the biggest things that I love to see is that they did divide us into regions, forcing us to have dispensaries all across the state, meaning that's access for all our patients. But on an even bigger point, we have jobs now for everybody. So as you can see the breakdown, yes, the Southeast region has some of the biggest amount of dispensaries. That is because that is going to have the Philadelphia area. But as you can see, there needs to be grow operations and facilities. Our dispensaries are located in Allentown, Bethlehem, and Stroudsburg. That would be the Keystone Canna Remedies. And the apothecariums are located south of us at Lancaster, Thorndale, and Plymouth Meeting. So here's just to give you an idea of what it's like within the dispensaries. We really work to make sure that that patient experience is everything they need it to be, to give them the information that they need, to make sure that not only do they get it there, but they have something to take home with them too. Because we throw a lot at you. Even today, I'm throwing a lot of information at you. So how do I make sure you retain it? We really try to make sure that they have instructions, guides on not just how to take it, but how to utilize the different devices. We make sure that they have, if they have questions, let's make sure we give them as much information as possible. And that really is our goal, is just allowing people to be at ease for such a new and different experience. What I find interesting is one of the hardest questions at the dispensary for a patient to answer is, what is your goal of therapy? What do you want to get out of this? It's not often that you go to a doctor and the doctor asks, well, what kind of benefit do you want? We're so used to a medical setting where we're told what we need to do. You need to take this to get your blood pressure lower. You need to take this and not feel pain. Well, you might have pain, but maybe that's not your goal. Maybe just to get a good night's sleep is your goal. So what is your goal? And that's really what we try to work with our patients there. What would give you that quality of life? Because what I think it is not going to help you. You have to let me know what would give you quality of life back, and I can help you get there. So this is just a little insight into our dispensaries. I know a lot of people get nervous as to what is it going to look like? Is it going to be very seedy, kind of shady, backyard deal? No, it's very comforting. All our locations, they have lobbies, they have private consultation centers, which is what you see those doors there. Very open, because we want our patients to feel like this is, again, that at ease experience, because it can be very intimidating coming in the first time, and we never want it to be that way for our patients. So these are just some of the examples of the product lines that we carry. Some of the grows that are within Pennsylvania, there are more coming on board every day, just allowing for that variety and to really allow for different products for different patients' needs. So with that, I open it up to questions. I can't have answered everybody's question. I think Leanne Snyder had a question.
Monica, I was just curious, if you had someone that did have dementia that wasn't able to make that decision for themselves, but their family wanted to make that decision for them because they were in pain, how would that look?
Yeah, so that's where that caregiver card becomes really a necessity. So we do have a few patients who they do come in, but they do have their caregiver or their family members come in with them. And really what it looks like, you still have to register the patient, but there's some interesting nuances within the state of Pennsylvania. So one is that patient can be considered a homebound or a patient not able to make medical decisions for themselves. They don't necessarily have to get a card, just be evaluated that they are eligible. And then that caregiver with a card can come in. There are other scenarios where we have some early stages of dementia or Alzheimer's coming in, and they'll come in together with their caregiver. We don't always have to, the caregivers aren't necessary to be inside the dispensary and purchase, but we will talk to family members over the phone, via email, however is convenient for them. Sometimes we'll set up virtual visits with family members so that we can all be together and have that conversation about what are the goals, where are we at, or sometimes they'll send information through that certifying doctor too about this is what we're looking at. But it really comes down to they get certified the same kind of way, everything registered through the state, but they have the decision of whether they want a caregiver to be that person who's going in for them all the time. or just being that voice. And again, that's where we set up all these different ways. Beauty of technology, we can do it via phone, we can do it chats like this, or they can come in and have a one-on-one with us.
Thank you.
Mhm. And we do work with some nursing homes too to set up dosing guides. We get creative with dosing. I probably should mention that too. One of the hardest things with dementia is having them understand how to take their dose. So sometimes we'll get creative and put like tinctures in a capsule. It's easier for them to swallow a capsule than have to measure out. We have pre-made capsules, but if we need to get creative, sometimes we'll teach families how to make something more palatable. So if somebody's fighting on, I don't want to take a pill, I don't want to take a pill, we'll teach those families too how to make a gummy bear or how to make a cookie. Or one gentleman who I love because he gets so creative, he likes to cook dinner with it. So he'll make her salmon. And so she loves salmon for dinner. So she'll eat her salmon and not even know that she's consuming cannabis because it's just dinner. So we get very creative with how we can dose our patients. It works the same way with some of our children, our pediatric patients, that we have to get a little creative with how we get them to take their medicine. I think I see a hand raised. Heather, the question?
Hi, yeah, can you hear me?
Yeah.
Hi, so I'm a nurse practitioner and I work inside of a nursing home taking care of the geriatric population. I see a lot of patients with a lot of the ailments that you discussed today. And I guess I have a two-part question. I guess first, if I wanted to be able to prescribe medical marijuana for my patients, I'd have to go through the program and get certified, I believe. And then secondly, are you seeing a lot of barriers to treating patients inside the nursing homes? Are the nursing homes, are there policies against their use, or is, because it is in Pennsylvania legal for medical marijuana, is it allowed in the nursing homes without any barriers?
So that's the loaded question, but I do have an answer to it. So first, yes, to prescribe, you do need to get certified through the state. And they do have, it's pretty simple getting certified through the state. I shouldn't say it's pretty simple, but it's the same website that I had up there, the medicalmarijuana.pa.gov. They have the physicians registry. I believe at this point it is only physicians, MDs and DOs who can do the certifying. They have a second sector, which is nurse practitioners, pharmacists, and physicians assistants. However, that's for us to work within the dispensary and be those basically your dispensary clinicians, if you will. It's the same process. You put in all your information. The only difference, we don't go to the doctor. We do a 4-hour CE credit that goes over kind of the regulations and what we need to know. To your other question about nursing homes, so we do work with some nursing homes. It really comes down to the policies that the nursing home themselves set. I think with the new regulations that are being voted on, you'll find that there's going to be a lot more involvement with nursing homes, because one of the things that they're putting in the new legislature is to allow for facilities to sign on as a caregiver. So now you have people who can then not only help, can now help administer, help get the products. It's actually, if you look into New York's program, they had it figured out when it came to, they have a lot of other hiccups, but they've got this figured out about how to have institutions be caregivers, and those institutions then be that place that you can coordinate. It all comes down to legalese about how you write those policies, which is why I think certain nursing homes do and certain don't. But those who do, generally what I've noticed is that they want just a written out plan. And like I said, we send patients home with information. So we sent them with their instruction guides that says, take 1 pill twice a day, or if we're in a titration, we'll write, 10-19, take 1 pill, 10-20, 1 pill, 10-21, 1 pill. Okay, 10-22, if you feel you can tolerate 2 pills, till we get to what we call the sweet spot. So they really just ask that we have those written out directions so they have something on file. And I think this follows under, I'm trying to think of the guideline, because I had to help write one for a center or a home for autistic children. It just had to follow those specific medical guidelines, and some it's just they get a training, they write the guidelines, and then that's enough to be covered under state and law and not have to worry about like losing federal funding. So it really comes down to, unfortunately, the lawyers setting out that all that black and white and that gray area.
Right.
But there are nursing homes that do that. And I think the new legislation really will be a key player to allow facilities to really be a lot more hands-on and to be those providers that they want to be, because they know it'll benefit.
Right. Great. Thank you so much.
Yeah. I think Jillian had a question. Hi.
Hi, Monica. Thank you for your presentation tonight. Very informative.
Hey.
I did have a question. Even though medical marijuana is legal, but say I'm still working, and if I have an accident at work, my company does do drug testing. How does that get handled if I have a medical marijuana card?
So first, it depends on the company. I always have to preface that. It always depends on the company. However, more and more companies, because they're national, or just they've been in the state, they recognize that medical marijuana programs are there. So start to develop policies that fall in line with those policies that they would for those employees who are on opioids, and recognizing that if an accident, if you were on oxycodone and gotten that same accident, they'd be trying to look for levels, they'd be trying to assess the scenario, and to see what was attributable. So yes, there's always that concern, but more and more companies, just because, like I said, 36 states have it. If you are in a company that is in any of those other states who have been having programs longer than us, they do generally have protocols that fall in line with those of opioids in the workplace.
Thank you.
Mm-hmm. Any other questions? Oop, I think you're still muted.
Sorry.
Oh, there you go.
Can you hear me now?
Yes.
There you go. I'm sorry. I'm talking and no one's hearing me. Thanks for your presentation. We really do appreciate it, and your time this evening. I just want to thank everyone else for joining us this evening. Just a reminder that next week we'll bring you another informative speaker. Lehigh Valley Health Network will be presenting on working through caregiver stress. So we'll see you next week at 7 p.m.